thoughts on, can we accomplish the goal of transforming Medi-Cal if we do not unify providers and advocates? And could you also give us some insight into how difficult a political lift you think this is? So starting with Dustin again.
Sure. Can it be solved without active engagement in the political system? Absolutely not. Medi-Cal is a state program. The state legislature and the governor decide how much it's going to be financed, if it's going to be financed, or whether it's going to be financed at all. And you've heard, and you all know quite intimately, how woefully underfunded it is, how embarrassing it is that we're last in the nation. What happens over in the Capitol all too often is a lot of us get platitudes, we get pats on the head, we all get victimized by our own self-interest and start separating and being picked off or allowing ourselves to be picked off one by one. Maybe the doctors go out and do something that's good for them, the clinics do something that's good for them, the hospitals try and get something that's good for them, and we all just try and be happy with our little piece of the crumbs that are left behind in the state budget. There is no way to take on the political intransigence that is there in Sacramento, that to get past those platitudes, get past the nice things that legislators like to say about Medi-Cal, and actually get them to commit the financing to Medi-Cal to make it work. The only way you get there is all of us getting away from those proprietary pieces, doctors being willing to put in the middle what's good for the common good, not just for our self-interest, for the clinics, for the hospitals, for SEIU, for the health plans, for everybody else, to put aside that and just say we're going to stick together. We're not going to be allowed to be conquered and divided for peanuts. We're going to stick together, we're going to make the system work, and we're going to make sure that it's financed. Can't get around the politics of the situation, can't get around the fact that it's the governor and the legislature that decide whether it's going to be financed and how appropriately it'll be financed. So what I am really encouraged about, in the last year when we came together for the rally that Dave talked about, We Care for California, I can't tell you how fired up the physicians were to see all of you rallying for the common good, rallying for something that was beyond yourselves. It was inspirational for them. They took that to heart, they took it back and committed themselves to meet you in that same way, to be able to commit to work together for the common good, not for our little piece of the pie, and really to fix Medi-Cal for the long term.
Go ahead, Carmel.
Well, I think with each of us playing different roles in providing care, it's no surprise that we might have unique perspectives on the Medi-Cal system. But that being said, we're all here today because we agree that the Medi-Cal program is critical for the future of California. But Medi-Cal's challenges must be addressed to ensure the future of healthcare in our state. And in fact, we have a history of the groups here, SEIU-UHW, CPCA, the Medical Association, the hospitals, working together to address healthcare problems, to meet challenges, because I think we do share a common vision for a future healthy California. An example is that the association I represent, CPCA, is pleased to be part of the Let's Get Healthy California task force that SEIU-UHW played a leadership role in establishing to address Medi-Cal health transformation. This could potentially bring $100 million to the state of California in federal funding to advance delivery system reform. We've also been a partner in the We Care for California coalition that was just mentioned, that has attempted to address the issue of Medi-Cal rates, a very important issue. And certainly, we all joined together to advance the Medi-Cal expansion with the huge victories for healthcare reform in California. So certainly, all of us working together have shown the ability to get results, which is very critical. But certainly with the Medi-Cal program, there are a number of issues that need to be addressed. And for my constituency, just a few thoughts alone, we have the rural expansion. Medi-Cal managed care just went into 28 rural counties that previously didn't have managed care. We have significant issues of provider network adequacy, access to hospitals and specialty care. The workforce capacity issue is critical, impacting all sectors of the healthcare industry, not just the Medi-Cal program, just to name a few of the challenges that we face. But certainly with the leadership, excitement, and commitment of all of you in the room today and all of us, we can certainly make great strides toward improving and changing the Medi-Cal program and having a positive impact on California. But it won't happen overnight. And certainly it won't happen if we all don't come together, really like we have today, to discuss the issues that are impacting us and see how we can work collectively toward a common goal. But I think importantly, our work together needs to go beyond the Medi-Cal program. We need to look at the broader healthcare issues. There's many issues of critical importance, including the fact that millions of Californians have been left out of healthcare reform altogether. We can't lose sight of the fact that we will never truly have healthcare reform unless all Californians have access to coverage and care, including, importantly, the undocumented population. These are the issues that we also need to be working on, a united voice for the immigrant population, so that we can ultimately all achieve healthier communities and healthier lives. So is it a heavy lift? You betcha. But 23 years ago, when I got started in this endeavor, healthcare reform, the Clinton plan was introduced, and it didn't go anywhere at that time. But certainly it is a lesson in never say never. We had a bill introduced. That would look at providing Medi-Cal coverage for the undocumented population. Again, never say never. Maybe not happen this time. Maybe it's not going to happen next time. But certainly we have hope that it's going to happen. So can we, joining forces, fix the Medi-Cal program? I think it is very possible.